Well, I need to talk about birth defects and congenital events today. We're really in trouble. Right now, experts are saying our kids are not going to live as long as us, and many people will be standing at a gravesite burying their kids, not from drive-by shootings and accidental deaths, car wrecks, and things like that, but diseases that are considered to be natural causes. Heart disease, cancer, things like diabetes and obesity. We're going to be burying our kids. There's something wrong here. What's going on? Let's go all the way back to the beginning. When the sperm fertilizes the egg, you have to have everything ready, stockpiled, just like when you're going to do a construction or you're going to do a battle. They don't pull the trigger on a battle until all the weapons, all of the ammunition, all the personnel, everything is ready to go. You can't just start declaring war and then say, oh, we got to have 6 months here to gather up and build up. No. The war is won or lost before you pull the first trigger. Same way with a baby. A healthy baby is won or lost long before conception takes place. The mother particularly has to be in good shape nutritionally because she's the one that is delivering the raw materials for that embryo to develop properly. When that sperm fertilizes the egg, the trigger is pulled, everything's happening from that second by second, minute by minute, hour by hour, day by day, week by week, month by month. The first 91 days is most important in a human being's life. That embryo, as it's developing, is moving down the rails on an assembly line. If there's anything missing along the way for moments or hours or days, or if the dosage of what's supposed to be there is way down, it's like 10% of what it should be or 50% of what it should be, something is going to happen to that embryo. And some of the ones that people don't think about are the inborn errors of metabolism, where biochemical damage is done to the DNA and RNA and enzymes that are required to make things happen. Like people who are lactose intolerant, that's a birth defect. Lactose intolerance is not genetic, it's a birth defect. Mom is missing something when that whole enzyme system is farming. But you can make up the difference by taking enzymes before you go to the ice cream party. Then there's PKU, phenylketonuria. You can't handle phenylalanine, which is a common amino acid in proteins, and so you have to read labels and avoid phenylalanine to avoid having all kinds of clinical effects, including mental disorders and so forth. And then, of course, there's sickle cell anemia. That's not genetic. That's not a genetic birth defect. It's not related totally to the black community. Sickle cell anemia in the white community, particularly around the Mediterranean, is called thalassemia. It's the same disease, just a different group of people. They just gave it a different name, same problem. And again, this is a congenital defect in the DNA that produces the proper hemoglobin proteins. Well, you can make up the difference for that. You take your 90 essential nutrients, you take your ultimate selenium, you throw in some B6 and things like that, B12, all the things that are necessary to make good hemoglobin. Guess what? You can go through life and never have a crisis and never die of a stroke caused by these sickle cells piling up. We've eliminated these diseases in animals by giving the mother proper preconception nutrition long before conception. And then you have more serious birth defects, ones like cleft palate, cleft lip, belly button hernias of all sizes. And then you have cerebral palsy, which is one of those gradient defects where if, say, 10% of the cerebellum is missing, the kid's going to have a funny gait, walk funny, may be a little uncoordinated, trips over his own feet. Nobody really thinks of it as cerebral palsy. But if 25% of that cerebellum goes underdeveloped in the first 3 to 9 weeks of pregnancy, suddenly now you have a kid that's lurching around, and everybody knows, even a little kid knows, hey, they got cerebral palsy. And then if they have 50% of that cerebellum underdeveloped, guess what? They're in a wheelchair. 75%, and they're in real trouble. It's going to cost you, the parent, and or the community $5 million a year just for maintenance because that poor child is doomed to the wheelchair. They're bright, they're intelligent, doesn't affect their intelligence, but this is a totally preventable birth defect. Then there's Down syndrome. This is a zinc deficiency in the first 10 minutes of pregnancy. That's right. First 10 minutes of pregnancy, if you're zinc deficient, you're going to have a high risk of a Down syndrome baby. Now, here's a crazy thing. If you're taking all 90 essential nutrients, you don't have gluten intolerance, or if you have gluten intolerance, you're very careful about being gluten-free. You take your 90 essential nutrients, it lowers the risk of having a Down syndrome baby at almost zero. We've done it in the animal industry. Why not people? And then, of course, I have reversed it one time in a human being. Lauren Knievel, Evel Knievel's, the daredevil, his niece-in-law, Lauren, she came to me at 2.5 months pregnancy, said she had 2 different tests by 2 different labs saying she had a a Down syndrome baby. She didn't want to have an abortion. So she said, please, doc, let's do what we can to save this baby. So I gave them all 90 essential nutrients, extra zinc. Baby's born perfectly normal. That's the only one I've done. It was at 2.5 months of pregnancy. I believe at 90 days of pregnancy, you can't go backwards with Down syndrome. You got what you got at that point. And then every other kind of physical birth defect, heart defects, limb defects, webbed fingers, missing fingers, too many fingers. Limb defects are amongst the most common physical birth defects. And then, of course, there's behavioral birth defects. There's fetal alcohol syndrome, fetal drug syndrome. There is babies that are born that have mental retardation because the parts of the brain that do the thinking, cognition, problem solving, and so forth just aren't there, or they are only 50% there like they should be. And then, of course, there's the homosexuality piece, hermaphrodites, and all that whole genre, okay? All these congenital events are preventable. They're not reversible, but they are preventable. Preconception nutrition. Don't wait till you've missed 2 periods, ladies. Start taking vitamins and minerals. Take them when you're born. And then the odds of you having a birth defect is almost zero. We'll be back after these messages. I want you to think about this. Right now, medical doctors, according to the Journal of the American Medical Association, and the Center for Disease Control, medical doctors each year in America kill, injure, and infect 15 million of their customers at their workplace right here in America only. 15 million of their customers or patients are killed, injured, and infected in hospitals and clinics over America each year. Well, guess what? They're a protective monopoly, self-policing. They've killed off all their competition with legislation. They get a walk. Nobody even gets a parking ticket. Nobody gets an OSHA ticket. So the only way to stay safe is to learn how to take care of yourself. You want to add many healthful years to your life. Get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Stay away from doctors and live. Go to doctors and die. Okay. Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about IVF, as I've got a CNN story that's headlined, record number of women using IVF to get pregnant, and they're referring to in vitro fertilization, and this all comes from the Society of Assisted Reproductive Technology. They are a group that represents the majority of these clinics across the United States. And they say that the report showed that doctors at these clinics performed 165,172 procedures, including IVF, with 61,740 babies being born as a result in 2012. And they say that's about 2,000 more babies using treatments from IVF clinics than in 2011. They say that also makes 2012 the year with the highest percentage of babies born through IVF than previously ever recorded. Says an upward trend is opposite of the American birth rate overall since 2007. It's been declining steadily in 2012. There were more than 3.95 million babies born, according to the CDC, and they say that's below what demographers would call a replacement level, the level in which a generation can replace itself. And they say these IVF treatments account for about 1.5% of all babies born in the U.S. that year. So it doesn't necessarily mean Americans are having more trouble having babies. I think you would disagree with that. They say it's more to the fact that they're having babies later. In 1980, the average age of a new mom was 22, and now, according to the CDC, the average age of a new mom is 26. Say women today are generally healthier, and fertility does decline as people age. They have fewer viable eggs. Men their sperm don't swim as well, and they say the IVF success rate is significantly higher for women under the age of 35. They say looking at IVF treatments only with fresh embryos from non-donor eggs, they go on to say that the number of women under the age of 35 who gave birth using IVF was about 40% compared to 31% for women between the ages of 35 and 37, and only 3.9% got pregnant of those over the age of 42. And they say these cost about $12,000 a pop, and that doesn't include any extra drugs you may need. And also, usually they have to do it more than once in order to get a take or to actually get a conceive and get an embryo. So there you go. And I know you have some real success rates on getting
and of course, you're looking at an average of $25,000 for a viable pregnancy from in vitro fertilization, IVF, artificial insemination, all this stuff. And I always tell people, give me 4 to 6 months. Give me 4 to 6 months. I've gotten so many women in their 50s and 60s pregnant. I actually have gotten more women pregnant than Solomon and Moses, okay? It's one of those things where even if you're kind of in the later years, you're in your mid-20s to your mid-30s, or even your 40s and early 50s, if you're still cycling, don't spend $25,000. Give me 3 to 4 months, and the odds are I'll get you pregnant. Of course, I don't do this on a dating game. I do this certainly with nutrition, a diet. We're very, very successful. We literally have thousands and thousands and thousands and thousands of women every month who I'm able to get pregnant using a diet and the nutritional program. And so give me 4 to 6 months before you decide you're going to spend $25,000. And of course, I'll have a very much lower risk of birth defects than you will through IVF. There's no guarantee that you're going to get a perfect baby with IVF, right? You might get a pregnancy, but it might not be a good one. And of course, we have a much higher rate of having good pregnancies than they do. So stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Virginia. And Steve, you're on with Dr. Wallach.
Hello, Steve. You're on the air.
Yes, thank you very much. I just had a question about ringing in the ear. My wife's had this for a time. I think it might have improved a little, but I guess just needed some information on how to end that.
Tinnitus, ringing in the ears, is actually a squeezing of the auditory branch of the eighth cranial nerve. The eighth cranial nerve has two major branches. One is the auditory branch, which deals with hearing and noises, and then the other one is the vestibular branch, which deals with balance and that sort of stuff. Well, how old is your wife?
62.
Okay, well, she has osteoporosis of the skull. Okay, and does she have any dental problems, or receding gums, or periodontal disease, or dentures, or anything like that?
Somewhat. There have been some teeth extracted in the past.
Yeah, she has osteoporosis of the skull. She has bone loss in her skull and jaw. And what happens is when you have bone loss, when you have lack of minerals anywhere in your body, osteoporosis anywhere in your body, the bones try to make up the difference by generating connective tissue called bone matrix. And in the case of the skull, there's 12 pairs of cranial nerves, 12 coming off each side of the brain, out through the skull, and doing things. And, of course, the eighth cranial nerve, the auditory branch, deals with hearing and noises. When it gets squeezed, it's coming out through that tunnel. You start getting a gradual loss of hearing. You start getting ringing or tinnitus. Sometimes it's a tone, sometimes a chirping sound. People refer to it as a cricket sound. And it comes and goes. Sometimes you get the steady tone just forever and drives people nuts. And so basically, what does your wife weigh now?
About 91.
Okay, so she's less than 100 pounds?
Yes. Yes.
Okay. All right. So what I would do is I give her one healthy bone and joint pack per month. Give her a half ounce of everything during the day, and then a half ounce at dinner time, half ounce of everything at breakfast, half ounce at dinner time, a half a dose of everything at breakfast, half a dose of everything at dinner. And then I would take the CM cream that comes with that. It's an analgesic or pain-relieving cream, an anti-inflammatory cream. Get a Q-tip and put that down in her ear. Let her do it herself, like she's trying to get wax out of her ear. And oftentimes, these types of tinnitus or ringing in the ears will go away in 10 minutes. It'll gradually come back after 3 or 4 hours. But after 3, 4, 5, 6 months, it'll be gone completely. You can speed up the process by getting her an extra quart of the OsteoFX Plus. Have her take an ounce before bedtime with a glass of water. And get her an extra bottle of that CM cream because she's going to go through some of that. Keep her away from fried foods, processed meats, oils, gluten, anything that's inflammatory. It'll speed up the process. Call us every couple of weeks, Steve. Your wife will be a new woman. She'll hear you whistling. We'll be back after these messages.
Let's head to Houston, Texas. And Diane, you're on with Dr. Wallach.
Well, Diane, you're on the air.
Yes. Hi, Dr. Wallach.
Hi.
Yeah, I was calling because I'm one of those persons who's older woman. I'm about 64 years old, and I've been trying to lose weight, and it seems that the more I try to lose weight, I'm putting on weight.
How much do you weigh?
I'm just wondering whether or not there's some kind of vitamin deficiency or something I may have, but then I'm also on some medications, too.
Okay, well, first of all, how much do you weigh?
I'm weighing 205 right now.
Okay, and how tall are you?
About 5'5.5".
Okay, and you say you're taking medication. What are you taking medication for?
I'm taking medications for PVCs, and then I also take it for high cholesterol.
Okay, what's your cholesterol number?
I think the last time I went to the doctor it was probably 182.
And that was with medication?
Yes.
You must get off your medication for cholesterol immediately. You do not want to get below 220. 220, 270 is normal. You get below 200, you're going to get Alzheimer's disease and type 2 diabetes if you don't already have it.
Mm-hmm.
Now, I'm serious. You must drop off that statin drug to lower your cholesterol. In fact, the FDA sent your doctor an email or the little weekly note called the Mortality and Morbidity Report and said, get your patients off of statin drugs. They increase the risk of Alzheimer's disease. They increase the risk of type 2 diabetes. Do not let them take the drugs. So your doctor has failed you if he hasn't taken you off that drug. Now, your PVCs, preventricular contraction, contraction. Do you have a back problem, Diane?
No.
I'll bet you do. Okay. How long have you had this heart thing? A lot of times they'll call it AFib, atrial fibrillation.
Yeah, I've had that for about maybe 5 years.
You have a back problem, dear. Okay, now, is usually up in between the shoulder blades? It's not something like low back pain. I'm not talking about pain. Have you shrunk in height since you were 20 years old?
I don't think so.
Oh, you need to measure yourself. Most people don't realize it. They've shrunk an inch, 2 inches. They don't even realize. I get people say, I have no way. And I stand them up against the wall and measure them. They've lost 7 inches, some people. Okay? So, let me ask you a couple of questions here. Do you have any skin problems, any eczema, dermatitis, or psoriasis?
No.
Do you have any history of asthma?
No.
Do you have any history of constipation or diarrhea?
No.
Do you have any history of having children?
Yeah, I had problems with, yes.
Okay. You have children?
Yes, I do.
Now, do any of them have asthma or skin problems?
My daughter has skin problems.
What, like eczema, dermatitis, psoriasis, rosacea? What's she got?
She's got really severe acne.
Okay, and how old is she?
31.
Okay, yeah. Adult acne is called rosacea. Okay? And, yeah, she has a gluten intolerance, so I want you to hang on. Shar and I will be back and give you a program. You're going to have to pass this on to your kids, any brothers and sisters you have. Your mom's still alive. She's got to get on all her siblings. We'll be back after these messages. Okay, Doug, let's go right back to Texas and Diane. Okay, Shar?
Yeah?
What would you do for this lady?
First of all, she needs to get on a gluten-free diet, no question about it, and she needs 2 healthy bone and joint packs to rebuild the cartilage and everything back.
In the disc between her vertebrae.
In the disc between her vertebrae, so she'll stop having an irregular heartbeat.
Excellent, excellent. And, of course, the gluten-free diet is going to help her. Of course, her daughter's the one that's got the acne, I think. Yeah, and her daughter needs to do the same thing. And what would you do for her weight at 205 pounds? She needs to lose about 40, 50 pounds.
We have a product called ASAP, which stands for as slim as possible, as soon as possible. Drops that you put under your tongue and let absorb into your mouth.
Absolutely. 30 minutes before each meal. And usually within a couple of days, you start losing anywhere from a half a pound to 2 pounds a day. And so do give us a call. Every couple of weeks, Diane, we want to know your weight. We want to know your blood pressure. We want to know your pulse. Let us know how that AFib, a.k.a. PVCs, are doing. And get your daughter going on this, and your sisters and brothers, anybody still alive in your family. And you're going to help them add 25 to 50 healthy years to life. If you leave them stay on gluten, it's going to be a mess as they get older. Okay, Doug, let's go to callers.
Let's head to Houston, Texas still, and Martine, you're on with Dr. Wallach.
Well, Martine, you're on the air.
Yes, sir. I'm nursing a broken bone in my hand. Actually, it's my finger. And I got lack of energy, and I got ED.
Okay. Now, do you have any skin problems? Dry skin, eczema, dermatitis?
Acne.
Acne, okay. Adult rosacea. Adult acne, rosacea. How old are you, sir?
42.
42. All right. Are you taking any medication like statin drugs to lower your cholesterol?
No, and I got on a gluten diet like a month ago.
Oh, excellent. Good start. And how many eggs a day do you eat?
I've been taking like 6 eggs a day.
How long you been doing that?
Maybe 2-3 weeks.
Okay. Yeah, it's going to take you a month or so for those to kick in. But testosterone, which is required for a good sex life, is 95% by weight cholesterol. It's a steroid hormone, and so you have to be taking in enough cholesterol so the testicles can make testosterone so you can have a good erection and do the job men were designed to do. All right? So this is something, 6 to 8 eggs a day. They have to be poached, soft yolk, soft boiled, soft yolk, soft scrambled in butter, not oils or margarine. And let's see, what bad food should Martine look out for, Shar?
No fried food, no margarine, no salad oils, no burnt animal fat, no meat with nitrates or nitrites.
A+, very good. You have to clean up that act, get away from things that actually causes inflammation and counteracts having a good supplement program. And what do you weigh, Martine?
I weigh 140.
140, okay. And so with everything going on there, I'd go ahead and have 2. It's a little heavy-handed, but that's fine. I'd go ahead and take 2 of the Healthy Heart and Brain packs per month. That'll allow you to have 3 selenium twice a day, allow you to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 before breakfast and dinner, or with breakfast and dinner, excuse me, and then 3 of the EFA Pluses twice a day, 3 of the EFAs twice a day. And then we actually have a stick with a powder in it. Comes in capsules too. It's named after a car shar. What product is that?
GTO, get turned on.
Exactly. So I want you to take the capsules every day. Take 2 of those every day, and then maybe anywhere from 30 minutes to an hour before you go to bed, go ahead and drink the drink GTO, and you will get turned on. Okay, Doug, let's go to callers.
Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Okay, Gottfried, you're on the air.
Thank you very much. It's regarding a lady in Luxembourg. She have a 6-year-old daughter who have something like infection in the urinary tract, and took her to hospital, and she was given antibiotic. For 5 days, she was antibiotic resistant. And then on the 5th day, which was last Friday, they checked her. They found out she's deficient in protein. She's been admitted, but what can we do for this little girl?
Okay, let me ask you a couple of questions. Have you seen her with your own eyes?
No.
Okay, you might ask some questions if the child has any asthma or chronic bronchitis or respiratory problems. Does the child have any skin problems, eczema, dermatitis, psoriasis? Does the child have any constipation? Anything where she might malabsorb nutrients? Because it's not unusual. It's not unusual when these kids are 4, 5, 6 years old. They have these really weird things going on. They're not absorbing protein. They're not digesting protein because their whole digestive system is messed up because they have a gluten intolerance. They just can't handle all the good German breads and everything and pastas and noodles and biscuits and muffins and cakes and cookies. Can't have that stuff, and it's exhibited by these other signs. Well, I've actually seen little boys and little girls where their urinary tract is plugged up because they have a vitamin A deficiency that was secondary to a gluten intolerance, and they have tears running all the time. They're not crying, they're laughing and giggling, but they get tears running down their face all the time because a little nasal lacrimal duct that takes the tears from the eyes down to the nasal passages gets plugged by the same thing that's plugging their urethra. And they have painful burning when they urinate. Sometimes they can't urinate, and they have to be catheterized. And then they got these tears running down their face, and you got to get them on the 90 essential nutrients appropriate for their body weight. And a little child like that, you might give her anything from Does she weigh 50 pounds, do you know, Gottfried?
Yeah, she weighs 52 pounds.
52 pounds, okay. So one healthy start pack would last her 2 months, a half a dose of everything every day, and we would take a half of that half a dose at breakfast, a half of the half dose at dinner time, so it'd be a quarter of a dose at breakfast and dinner. And so that one healthy start pack would last her 2 months, and then get her on a gluten-free diet, and that tends to open up the urethra so they can urinate without pain, and it tends to open up those nasal lacrimal ducts because they're absorbing vitamin A now, and all the tubes are working properly, and skin gets better, everything gets better, everybody's happy. Otherwise, if you don't get her on a gluten-free diet, you don't get her on these nutrients, these kids just get sicker and sicker and sicker. They spend more time at the doctor than they do at home, and the results are usually very, very bad. Nobody will like the ultimate outcome here. So we need to jump on that full bore and, just keep us informed about this little gal. We love these kids and want to make sure that they get maximum benefit. And so do call us every 2 weeks, no later than that, but you're welcome to call every day on this child, Gottfried. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
Let's head to California. And Mike, you're on with Dr. Wallach.
Mike, you're on the air.
Hi, I've got a 10-year-old Labrador Retriever with heartworms, and I was wondering if you knew what we could do for her.
Okay. Well, heartworms can be problematic if he's got a lot of adults in there because they can cause a thrombosis. If you kill those worms, they go up into the pulmonary arteries out of the right ventricle where they tend to accumulate. And I've seen them as like a big double fork full of spaghetti get up in there and cause the sudden death of the dog. Is this dog having any clinical problems, or they just diagnose this on a routine blood test? In other words, does this dog have respiratory problems, heart problems, or just tired all the time, or what?
She's just tired. She hasn't been tested, but we've been in an area that's heavily infested with heartworms.
Okay, well, heartworms are easy to check out. You can either do that yourself, or you can just get a drop of blood from anywhere. Just kind of get one of these little lancets. You might stick your finger for a blood test. You can actually stick the dog in between the toes or on a lip and get a drop of blood. Get a microscopic slide and a little cover slip. You actually see these larvae. They're so common when they have them that there's so many of them. You actually see these worms wiggling around underneath the cover slip on low power. You can see them wiggling around, and they're actually pretty sizable little larvae, little wormy worms. As far as killing the adults, that is problematic. I'd have to look that up. You might look it up in the book if you have it, called Passport to Aromatherapy. You also might look under herbal. Let's play Herbal Doctor. I apologize, I don't remember. The ones that I know are dried pomegranate skin and dried avocado skin, but I'm just nervous about killing those worms because if there's more than just a few of them in there, when you kill them, you got a worm the size of a piece of spaghetti. You have 20 of those worms in there, they all die, they all bunch up and clog that pulmonary artery and kill the dog. So I would prefer to do other things. Give that dog some Arthrodex. It's 1 scoop for 25 pounds twice a day. I would check that blood and see if there's larvae in there, which are the baby worms. That means there's adult worms when you find the baby ones. So it's kind of an indirect way of finding out. They can actually do an ultrasound and tell you pretty much how many worms are in there. They can see if there's 1 or 10 or 25. So these are all kind of things I would do. Is check out and see how many adult worms there might be in that right ventricle and pulmonary artery before you start killing them, and that way you'll preserve the dog. Okay?
Okay.
Yeah, and then get back to me after you have run some of those tests, and in the meantime, I'll kind of look up some stuff for you, some natural approaches, okay?
Okay, great. Thank you very much.
You bet, Mike. Okay, Doug, how much time we got left?
We got just about a minute.
Just about a minute. I'm going to let Char take it. She's been out in the field with me here now. For a couple of days. She's going to be out in the field with me for another week. And what advice would you give people, Shar, who are really skeptical about this gluten-free thing? Because we were talking, and people don't believe how problematic it is. What would you tell them?
Well, like I said, I've been traveling around with you, and it's getting to be epidemic, and you can't deny it. I mean, it happened to me. I know I argued with you, Doc, about it, and I had a red spot on my forehead it was like a silver dollar from my eyebrow all the way up to my hairline. It was like bright red, like a scarlet letter, a big O, all burry, hairy skin. I didn't think it would ever go away, and you know, told me it was a gluten thing, and I refused to believe it. And then I got the runs so bad one night, had the runs 8 times in one night, and between that and the red spot, I had to go gluten-free, and of course the red spot went away. And if I have accidentally get a hold of gluten, I will get the runs right away, and that red spot will start to come back again. And so there's no question about it. There's absolutely no question about it. I see it with people. It's just an epidemic. It's bad, really bad. And,
okay, everybody. Thank you, Char. Get a hold of that CD called Serial Killers. You'll find out all the hidden places that gluten lurks. Protect yourself and the people you love. It's even gluten-free your dog, because it'll cause problems to your dog. Thank you so much, everybody, for great testimonies and questions. Thank you so much, Char. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.